Dr. Baselga, the fact that IMPAKT, it's such a huge effort with the Breast International Group. Tell us why ESMO really is making this commitment, working with the cooperative groups as you are.
One of the main goals of ESMO is to promote advances in cancer in Europe. We want to make sure that we have the tools in Europe to conduct cutting-edge research. And we feel strongly that we need to provide support to our cooperative groups. We have wonderful clinical science in Europe, wonderful clinical trials, superb cooperative groups that have contributed to major advances in the way we treat breast cancer. But these groups, they need support. And I think ESMO, an overreaching society that has many thousands of members, that has a lot of possibilities and strengths, ESMO can help by promoting further these groups that are doing a wonderful job. So I think this is at the core of the European Society of Medical Oncology mission.
You know, in the year that you've been president, and soon your time is transitioning, you have left a definite imprint. And I want you to tell us from where you began, because you had a vision then, you're leaving a very strong, your footprints are there. What is your current vision? So when you leave ESMO, where do you want to have it positioned?
When we started the presidency, that was the current executive board and myself, we had many meetings to discuss what was going to be our vision, and everything begins like this. You develop a vision on when do you want to go. And we had several issues that were very important. To begin with, medical oncology is not a recognized specialty in Europe yet, if you can believe this.
Yeah, it's very hard to believe.
So we said we need to get there, and we're getting there. So that was goal number one. Two, we need to empower our members. Our members need to have, better tools to assist in the way they treat patients, to have better tools to learn, teaching tools, professional career opportunities that ESMO can bring. So we developed a very strong membership momentum, and we empowered not only a lot of initiatives, but also we changed the web. We created a lot of new fellowships for young oncologists. So we also wanted to make sure that the young oncologists in Europe would have the opportunity to be trained in the best centers in Europe, so that we would create the leaders of tomorrow, very important. We strengthened the office. We actually increased our office personnel by close to 40% in education, in research projects, in meetings. And then we identified those areas in which we felt that we could do better. And one of them was breast cancer. And it was obvious to us that the degree of support that breast cancer cooperative groups have from the governments is very little. In Europe, we have little support to do clinical research. And a society like ESMO, as part of its obligations, therefore, is to do several things. First, we have established an office in Brussels, and we are lobbying very actively at the level of the European Parliament and at the level of the European Commission that breast cancer research is a priority. And we have all spent many days in Brussels, in the corridors of the Parliament, in the Commission, talking to members of the Parliament. We have identified members of the Parliament that are breast cancer survivors. And these members of the Parliament are on our side. And these are, so to speak, as our foot soldiers in the Parliament, the voice. So we have established a political awareness campaign. We have set goals on how much we would like research to be incremented. But then at the same time, we have created alliances with the cooperative groups. And one such product has been the IMPAKT Breast Cancer meeting, that the Breast International Group and ESMO have done together. We had the first IMPAKT meeting last year, huge success. The idea of this meeting is to bring basic researchers and clinicians to design better clinical trials. That was achieved in full. We also had very successful training workshops where pathologists and young oncologists would come and they would discuss about issues. So it's this kind of thing that I think a society like ESMO, what it has to do, it has to revitalize the field. We have to shake the field, and we have to be really avant-garde. I do a lot of laboratory research and clinical research, and I think our societies should be like that. They should be research in motion in a way, or research when it comes to making sure that we shake our members and that we align them towards our goals. So it's been a wonderful experience, and it's fun, and I think that societies have a life, and we have to feed them.
And the other thing that you've left your mark on, I've known you for a long time now, and I've had the privilege to interview you both in the US and in Europe. There's a heart about you. It's not only what you do in the laboratory and your clinical expertise and your leadership, but what always strikes me about you is your compassion, your empathy, and your real emotional concern for your patients, and it shines through, and I've always been touched by that, by you.